Which valve is classified as an AV valve? C. The mitral valve. AV valves or atrioventricular valves are located between the atria and the ventricles. The primary function of the AV valves is to B. Prevent retrograde flow into the atria. Retrograde flow also means regurgitation or backwards flow into the atria. Which valve is the largest of the 4 cardiac valves? D. The tricuspid valve. The tricuspid valve is not only the largest of the valves, it's also the most inferior valve. The tricuspid valve is located between which 2 cardiac chambers? A. The right atrium and the left ventricle. How I remember this is tricuspid has an R, which indicates the right side. During which phase of the cardiac cycle are the AV valves normally open? C. Diastole. During diastole, ventricular pressure is lower than atrial pressure, allowing the AV valves to open and permit ventricular filling. This is why the AV valves are also known as the diastolic valves. Which structure directly prevents prolapse of the AV valve leaflets into the atria during ventricular contraction? C. The chordae tendineae. The chordae tendineae anchor the AV valve leaflets to the papillary muscles, preventing those leaflets from prolapsing into the atria during systole. The annulus fibrosus primarily functions to B. Anchor valve leaflets between the atria and the ventricles. Which valve opens during systole and closes during diastole? C. The aortic valve. The aortic valve opens during systole when ventricular pressure exceeds aortic pressure, and then closes during diastole to prevent retrograde flow into the left ventricle. The pulmonic valve separates which 2 cardiac structures? B. The right ventricle and the pulmonary artery. Which statement regarding semilunar valves is correct? C. They prevent retrograde flow into the ventricles. The semilunar valves are the aortic and the pulmonic valves. They prevent blood from flowing backwards from the great vessels into the ventricles.